I just think we need to temper our expectations and realize that the stakes in healthcare are high. So this is not, e-commerce. This is not online entertainment. This is not social media, all of which, of course, have risks. The cost of errors are higher in healthcare.
Healthcare is crucial, yet healthcare systems in North America are falling behind. That's why healthcare is constantly highlighted as the industry that will most benefit from AI. What can other industries learn from healthcare's past and future implementations of AI? Our guest is Spencer Dorn, the Vice Chair and Professor of Medicine at the University of North Carolina.
I think it's a matter of designing solutions that are not just purely technology, right? You can't just deploy software. It's about redesigning work and redesigning how we do things and challenging assumptions that we've made for a long time.
This is episode 23, and we're exploring the challenges of implementing AI in complex industries. We discuss the successes and failures of AI in healthcare, why adopting AI is difficult and requires incentives, the risk of AI inundating users with too much information, and the risk of undervaluing the importance of relationships. We also discuss lessons for teams designing AI products in other industries.
But the real challenges are more how do you encourage people to use this new tool in a way that can help lead to better outcomes at their work. Often it doesn't happen because people have too many other competing priorities, where there's some downstream constraints, and they also undervalue the importance of relationships. So they overestimated the value of technology alone, and they underestimated the value of human clinicians, healthcare workers.
Spencer Dorn, MD, MPH, MHA, is Vice Chair and Professor of Medicine at the University of North Carolina. Drawing on his experiences as a practicing gastroenterologist, physician leader, clinical administrator, informatics physician, and academic, Spencer is particularly interested in how digital technologies are reshaping healthcare. He's a contributor to Forbes and one of LinkedIn's top voices speaking on healthcare plus innovation. Now we want to hear from you. How much value are you getting from using Gen AI? Please take 5 minutes to complete our survey. We want to understand how and why you use AI. And we're also starting to build a knowledge base of how professionals are getting the most value from AI so we can publish it in a report. Find the survey link in the show description and on our website, designof.ai. This also helps to inform what topics the podcast can cover in 2025. And remember, if you enjoy receiving pragmatic lessons and strategies about AI, follow this podcast and rate us on your favorite podcast app. It helps more people find this content. And if you never want to miss AI lessons and strategies, add Design of AI on Substack.
So nice to have you on the podcast. We reached out to you because you've also been really outspoken about just how AI can improve healthcare. Most importantly, you've been outspoken about how the capabilities of AI are overstated, while the value of humans in the healthcare system is maybe understated or underestimated. How does it feel being a realist amongst a choir of AI utopian hype people?
I think it feels natural. All of our beliefs are grounded in our experiences, and I've been fortunate to have many experiences in healthcare from different perspectives in healthcare, including, not just as a clinician or an administrator or a researcher, but also as a patient or a family member. So my opinions on AI are informed by those experiences and by my understanding of the technology, which admittedly, I'm not a computer scientist. I just know enough to be dangerous. So for me, it feels natural. I'm just to share what I believe are the opportunities and the possibilities without sugarcoating things or making it sound like everything's going to change tomorrow or everything will be magically fixed.
So how did you end up down this rabbit hole of trying to understand and unpack what technology can do? Was it some incident? Was it just some side passion?
I've written a little bit about this. I'm from this kind of interesting micro generation where digital technologies were part of my life from a relatively young age, but the world hadn't really changed yet. It wasn't until I was in college that the World Wide Web, internet was around for a long time, of course, but World Wide Web made it possible for us all to access. So I kind of grew up in this analog world, but when I was young enough, I transitioned to this digital world we're all living in. And I've seen that in healthcare as well. I started out in healthcare, we were using almost only paper. And I've, throughout my career, been part of this transition to a digital or digitized healthcare system. And these experiences, I guess, for one, I'm just curious. I'm curious about how things work, how the world works, how we could do things better, what are good and not good aspects of how things are changing. And so that was one big part of it. And the second thing that really clued me into kind of digital was just seeing how central it is, how central these technologies are to how we practice clinically and also how we operate our practices. I always say I'm not necessarily a technophile. I don't wear an Apple Watch. I'm kind of relatively early adopter, but I don't like just live and dream about more and more technology. I guess I come at it more from a pragmatic angle of clearly the world is shifting. These tools are playing an increasingly important role in how we live our lives and also how we practice medicine. Just kind of got curious about the potential impacts and opportunities and downsides of these technologies.
Thank you for listening to the Design of AI podcast. We interview leaders at the forefront of AI to unpack strategies and lessons for designers and product teams. Make sure to follow us on your favorite podcasting app. It really helps us if you leave reviews. To get more AI and career resources, subscribe on Substack at designofai.substack.com.
So a couple months ago, we actually had someone in her early 20s on. She was on with her father and they authored a book. And what was interesting about that conversation is we were reflecting on what the world was going to look like from her perspective. And she vocalized several times that she's going to be handing more of her faith and judgment and advice over to systems like LLMs, et cetera. What do you feel has changed in the healthcare system due to technology in the last 30 years? And what do you think might change in the next 30 years?
So I guess we'll narrow it to digital technologies. We're not talking about medical devices or new drugs or diagnostics. I mean, that there's been massive change in a lot of how we care for patients, how we diagnose patients, how we treat patients, how we perform different procedures through advances in technology in the past 30 years, many of which I've seen. I graduated medical school about 20, how many years ago was it? 22 years ago. So I've seen many of those firsthand. In terms of digital technologies, I think a lot has changed, but a lot has remained the same. And many of the promises that were made about what these tools would do for clinical practice have kind of fallen short. So I'd say a few things. One is it's much easier to access information than ever before. You know, in the old days, if you wanted to learn about a patient, obviously you could speak to them. Maybe if you had seen them before, there was a paper record somewhere you could find, but it was really incomplete, the medical record, right? It was fragmented across many different paper sources, and it was hard to understand what was it that went on in July of 1994 or whatever the year was. And now clinical information is readily accessible. And that's really the main benefit of electronic health records is the patients seen in your institution or often in other institutions that use a similar EHR, you could instantly, with a few clicks of a button, a few keystrokes, you could easily find out what happened when. And likewise, if you want to find out a scientific study or what are the guidelines for treating this condition, you don't have to walk to a library. You don't have to take out a book in your pocket like we used to carry these handbooks. You can go on the internet, right? You can go to certain medical websites. You can go to Google Scholar. So I think the main change has been that information is just far more readily accessible. I guess the flip side of that is that we're overwhelmed with information, right? There's just so much information. Most of it is not necessarily relevant to what you're trying to do. So we have a filtering problem where we're inundated with so much information and we have to figure out, well, of all this information, what do I want to pay attention to? But I would say that's probably the most fundamental change with digitization of healthcare is the accessibility of information, both scientific information and clinical information. And it's been mostly good, but it's also in some ways not been so good. Another thing is we're increasingly connected, right? Just like we're doing this podcast from far away from each other, we're increasingly connected to each other, both other clinicians and researchers and also our patients. which is wonderful, right? It's hard to argue with that. It's wonderful. We can meet people in different places. We could see patients when they're at home. They could send us messages when they're at work. We can message our colleagues without speaking to them face to face or picking up the phone. All that in many ways is wonderful. But there's a flip side to that as well. And the flip side is sometimes we're disconnected, right? Because we're trying to force everything through digital channels that may not be appropriate, but they're easy to use. So therefore we use them, even if sometimes a conversation would make more sense. And I think in many ways, we're more isolated from each other. If you walk around hospitals now, teams don't meet with each other as much as they used to. It used to be if I was on the GI service and if we were consulting for a patient who was on a hospital service, we would find time to get together and sit down and, run the list, like go through the patients that we're sharing and talk about them. And now often those conversations are done through secure text messaging, but those types of things. So we're more connected, but we're also in some ways further apart. And then the third thing I would say is that in many ways, digital technologies make us more productive. We could simply do more than we could in a purely analog world. It's really easy to enter medication prescriptions, right? You don't have to call the pharmacy and wait for the pharmacist to pick up and then read out. You could just, a couple keystrokes, you can send a prescription. That's just kind of one silly example. Or another would be physicians want to get advice from each other. It used to have to be you have to literally pass each other in the hallway or page someone and pick up the phone. And now we could do all that electronically through something called e-consults. But the flip side of that is we're also less productive in other ways because we're inundated with all this incoming noise and a lot of junk and nonsense and notifications that are pointless. But how has digital technologies changed healthcare? In many ways, they've changed them for the better. They've made information easily accessible. They brought us closer together with each other and they've made us more productive. But there have been some consequences, some negative consequences. We're overloaded with information. We have trouble sorting out signal from noise. We're more isolated in many ways and atomized and have less community. And we're often stuck doing kind of these nonsensical tasks that really are not benefiting anyone.
Everything you just mentioned, I think, is going to really resonate with the listeners. And the reason for this is those are some of the risks of the mass implementation of AI technology. And it sounds like common things that we're hearing from some of those organizations. But if we look into the future, many, many reports have isolated, identified, and prioritized healthcare as the industry which will gain the most from AI, where there's most to be gained from it. There's so much disintermediation of data and information and support services that AI should be the solution. But at the same time, when we look at the struggles of the US healthcare system, it's really well documented how poor the outcomes are. The US spends the most per capita. The outcomes are some of the worst overall. There's a report that it ranked last overall among 10 other high income countries on key issues such as equity, access to care, and outcome measures. So, with data this negative, does that make sense to you? Why people are so desperate for a Wizard of Oz solution to fix everything? How realistic is that?
Yeah, of course. One of the challenges with healthcare today is that no stakeholders are fully satisfied. Patients aren't fully satisfied. They often have to wait long times to see clinicians. They have trouble navigating this complicated, cumbersome system that we have. It can be unaffordable, does not always produce the outcomes they were hoping for. So patients are often dissatisfied with the current state. And you know what? So are clinicians. Clinicians feel like they're being pulled in too many directions. They feel like they can't keep up as fast as they're going. They're constantly being asked to do more. They're forced to deal with certain work that they feel like really is unnecessary for them to do. They're feeling a lot of strain, even sometimes burnout. And likewise, I mean, this is not just physicians, this is nurses, these are all healthcare workers to some extent, or I should say, many are feeling this way. And then you have employers. Employers are footing these exorbitant costs of ensuring their employees, and they're not getting necessarily the results they were hoping for. So it's one of these areas right now in current society where no one's really thrilled with the status quo. No one's really getting what they want. So naturally, there would be a desire to get more, and naturally, there's a rush to look for low hanging fruit and easy solutions that can fix problems. And we often hold technology up in that light, that if only we had this, things would be so much better. There's reason to be optimistic that we can harness this technology. On the flip side, as you mentioned, US healthcare performance, I think you were referencing the relatively recent Commonwealth report. The US healthcare system performs relatively poorly compared to other economically advanced nations in Europe and Canada, Australia, etc. And one of the challenges when you review those reports and you read the headlines, you would think, oh, it's just there's just it's just these greedy insurers or these lazy doctors or these whatever it is. It's easy to say why the US is failing here. But the broader challenge is that most people don't realize healthcare only accounts for about 20% of health outcomes. Meaning, if you're looking at someone's life expectancy or if they're going to how well they'll do with a certain health condition, most of what shapes that is actually not what's happening in a doctor's office, right? It's their lifestyle, it's their environmental factors, it's their genetics. Are they lonely? Are they disconnected? Have they suffered trauma? There's so many other factors that are far beyond the reach of medicine that explain a lot of what people experience. So when you compare the US healthcare system to other systems in Europe or Australia, it's a bit of an unfair comparison because you also have to look at the broader context within which healthcare is occurring. What types of social and economic programs are there? Is there a lot of inequality and disparity? What are the physical environments that people are living in, et cetera?
So this is obviously a very complex system, but given even that complexity in itself, would you consider healthcare a cautionary tale, a case study in the dangers of deploying technology to intermediate typically, human to human interactions, or do you consider it the perfect test bed for trying some of these new novel models of interaction?
Yeah, I can't say that there are certainly cautionary tales within healthcare of technology being deployed inappropriately, thinking back to things like IBM Watson within the past decade, where, this omniscient AI was supposed to, right, dramatically improve care for people with cancer and other conditions, and it fell very flat. I think you can argue that the experience with the electronic health records is a cautionary tale in so much as they have not resulted in the massive cost savings and improvement in effectiveness that were predicted, although they have brought many benefits. But I wouldn't say that technology in healthcare is a cautionary tale. I think it's necessary. I just think we need to temper our expectations and realize that the stakes in healthcare are high. So this is not, e-commerce. This is not online entertainment. This is not social media, all of which, of course, have risks. The cost of errors are higher in healthcare. So I think we just need to be careful and not overpromising.
This episode is brought to you by PH1 Consulting. Since 2012, we've been working with mid-size and large-size organizations to help them design the future of their businesses. Our clients have included Microsoft, Mozilla, Dell, Spotify, the National Football League, and many more. We offer product strategy services to accelerate your adoption of new technologies and validate new ventures and products. We help you envision your North Star, co-create possibilities, and roadmap your way to success. As service design and futures thinking experts, we deliver a vision for how to take your product to the next level, particularly how to incorporate AI into workflows to augment the capabilities of your workforce. Please visit our website at ph1.ca to book an intro call to tell us about your project.
Let's talk about one of the biggest barriers to technology in healthcare is adoption. The biggest barrier is always there's so many tools that are disparate that people are gun shy about having something new because there's been so many promises. And I think just generally, a lot of the guests that we've had on the show have discussed the importance of gaining adoption and the struggles around gaining adoption. The usual argument is that the technology needs to deliver enough value to convince users to adopt it. But after reading a lot of the analysis that you provide on healthcare and the case that you make around just the complexity of the healthcare system overall, that delivering value is a little too simplistic, right? And that sometimes the struggle of that system is even the feature, not a bug, right? So, can you tell us a bit more about your perspective on what it will actually take to create real change across such a complex system?
Well, I think first it takes humility. As you mentioned, healthcare has a lot of complexity. There are many people involved, and people are complicated, and work groups and or large organizations of people are even more complicated. Human disease and illness, very complicated. Many factors play a role. Foremost, we need to be humble and not suggest that, oh, if you only download this app, everything will be perfect. Because that's really turns people off, I think, people who work within the system and understand what it's really like. And so I think humility is important. I think for technologists, they need to understand what healthcare workers' days are like and what patients are experiencing. So getting close to the problem so they could develop solutions, ideally co-develop solutions that are solving real problems and not problems that don't exist or imaginary problems that would be easy to fix. So that would be a second thing that I would focus on. And then to your point about value, I think that's spot on. I think digital tools that bring value, that make people's days easier, that make people's lives better are appealing, of course. Often there's an adoption problem that it still takes effort to adopt a tool that may make your life better or may make your work life better. So we often need incentives. We have to align incentives so that, okay, we have this new tool. We're humble. We realize that we don't know everything. We've gone close to the problem and we've worked with people who are experiencing this firsthand and we've co-developed this solution that we think is going to solve a real problem, deliver value. Well, then how do we incentivize people to start using it, recognizing that no one likes to change their behaviors, right? We naturally rely on old habits. And even sometimes when doing things differently would be better in the long run, we need a little bit of a boost to get there. So there are different, I think, strategies for that. And then gathering information and gathering data, whether it's anecdotes or metrics or anything beyond that, to suggest that, look, people who use this solution actually, they're really happy with it. It's making their lives better. It's helping them get home for dinner on time. It's helping patients live with less discomfort, whatever it is. So I think that's the type of playbook that I think about all.
So let's get a little more specific, right? We must avoid the trap of technological solutionism. So, this was a conclusion of your October 31st Forbes article about electronic health records are a scapegoat for deeper problems. Can you tell me a little bit more about some of the AI healthcare products that you've seen fail and what we can learn from their failures?
Well, I think it's pretty early on with healthcare AI. It would be premature to say that something's failed completely.
Or maybe faltering, needing to adjust?
So one obvious example would be predictive algorithms. There are dozens and dozens and dozens of predictive algorithms that have been developed for identifying patients at risk of clinical deterioration or at risk of being readmitted to the hospital or at risk of some sort of adverse health event. There are many of them, but uh, only a tiny minority of those have actually been implemented in practice. Why? It's because implementing them takes work, right? It relies on people redoing how they do their jobs. It's an example. There are some technical challenges, especially with generalizability of models, that you can't just import them from one health system to another. So there are some technical challenges, but the real challenges are more how do you encourage people to use this new tool in a way that can help lead to better outcomes of their work? Often it doesn't happen because people have too many other competing priorities, or there's some downstream constraint that, okay, you're telling me this patient's at high risk of being readmitted to the hospital. Well, what do I do now? I have no tools am I supposed to go visit them, do a home visit every day for the next week? Like, I have no resources to help that patient. So I think, yes, a broad class of products that I don't want to say have failed, but haven't necessarily delivered on their promise would be predictive AI, and I think it's largely these models often struggle to be implemented because it takes work, there's no incentive, or there's some downstream need or constraint that is not being looked at.
I'm wondering if you can speak a bit to, I know you've been writing about this and having some critique on it, this doctor in a box and the way that they're trying to scale out the number of people that they can process. And do you have
Yeah.
any thoughts on that, whether that's functional or not?
Yes, I think you're referencing Forward, which, and I'm not here to bash on any company. I think it's great that that people are experimenting because the reality is healthcare is too inaccessible, too unaffordable. There are not enough clinicians in the US or Canada or really any country, probably. And there's certainly developing countries that have very, 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 very under resourced healthcare systems. So I like the concept. I'm all for concepts where that product missed the mark is they assume that the technology can meet more needs than it actually could. And they also undervalued the importance of relationships. So they overestimated the value of technology alone and they underestimated the value of human clinicians, healthcare workers, et cetera. The notion, certainly not an expert on the company, I've never used their products or been involved in any of their plans, but the notion was that someone can pay a subscription fee to access a little box that they could sit in and have different biometric tests performed and then analyzed by a machine that then it tells them what they should do to live a healthier, happier life. And I think for one, the technology is not there yet, right? I think AI models are good for certain things, but so much of medicine is this gray zone of uncertainty and preferences. One thing people don't realize is often there's no single right answer in medicine, right? Like there's not like, this is the answer. How often it's like, these are the options and let's help figure out which option is best for you. So that's one thing. The other thing is, I think people forget that people really like their doctors and their nurses, probably even more they like nurses. So the notion of kind of offloading all that I'm going to drive to a mall, I'm going to roll up my arm, I'm going to get some blood tests and some blood pressure and pulse oximeter and all these other things. And this machine is going to tell me what I should be doing. I think it's kind of ridiculous. I'm not saying that's never possible. I don't think that's what people want. And I don't think the machines can deliver at that level of reliability just yet either.
I wonder, in your research, just exploration, have you seen or come across any examples of AI tools where there is a proper handoff, where it's like it's AI, but then it hands off to the practitioner so that there is kind of a more enhanced cyborgic, relationship versus it being just technology or just practitioner?
That's of course the vision is we want co-pilots, right? We want assistants. We don't want to take everything away. There's this slogan that you'll see, you've probably already seen repeated, AI will not replace doctors, but doctors who use AI will replace those who don't. I think it's a little trite. I think it's a little, I don't know, in some ways that slogan bothers me, but I think there's some truth to it. In that the purpose, it shouldn't be a binary choice between human clinicians and machines. That's kind of silly. Ideally, it's a human clinician empowered by a machine, right? Like the great chess masters who work with AI, they're better than the AI alone. So I think that's a compelling vision. And of course, then you have this flip side of people talking a lot about agents, more so on the administrative side of medicine these days. But you can imagine that moving also towards clinical care. Um, so I think there are examples of human clinicians or other healthcare workers partnering, so to speak, with AI. The biggest use case right now, something I just published an article a couple of days ago about, are AI scribes. This is technology that uses ambient listening to listen in on a doctor and patient talking to each other, and then uses speech recognition to transcribe that conversation and pass it through a language model that will then write a doctor's note for them. And then the doctor, at least theoretically, is supposed to review that note, edit it, and finalize it. And the technology is actually spreading really quickly right now. There are many different vendors serving both the large health system market as well as small practices. And I think it's emerged as the leading use case for generative AI in healthcare. And I think by and large, it's not for everyone. Personally, it's not for me, and we can talk about why. But I think it is a tool that many clinicians will use moving forward. So that's kind of one. I guess perhaps that's the most obvious example of the, I don't know, would you say cyborg type view of healthcare technology?
In I think the post or the article that you made where you did talk about AI won't replace doctors. But I think one of the things that you said in that is really important to reiterate in all of this is one, the idea that adopting technology, especially in the healthcare space, really is about behavior change more so than technology adoption. But that healthcare may not fully embrace AI until a new generation of digital and AI native physicians and nurses enter the workforce. Can you talk a little bit about that particular part of the thinking and, and strategy that you see about how AI will actually make a positive impact in healthcare?
Just like you said, it's hard for us to change our behaviors. And invariably we need some sort of incentive or disincentive to shift. So there have been two large scale technology shifts in my career in healthcare, 25-year. One was electronic health records, which were widely adopted pretty rapidly in the US, but only after a literal act of Congress. So there was this act of Congress that then President Obama signed into law called the High Tech Act, which set up this incentive program whereby physicians and health hospitals and health systems would receive pretty sizable payments if they, quote, meaningfully used certified electronic health records. So it's kind of, became known as the meaningful use program. And we saw massive adoption. And within 5 years or so, we saw massive adoption. The second mass adoption, really even much faster than that, of a digital technology in healthcare was during the pandemic in March or April of 2020, when suddenly the world shut down and doctors couldn't see their patients face to face by and large, and patients still needed care, and doctors still wanted to take care of them, and they needed to keep working. So we rapidly pivoted to virtual care, to doing video visits. We've since fallen off. Those visits peaked at about 15 to 20% of outpatient encounters, and are down to about 5%, largely because the incentive is no longer there as much. But those are just two examples of why incentives matter. And so your question about why we may need a new generation's growing up with these tools, right? Kids who are in high school now, like they're using AI, they're on ChatGPT, they're speaking to Perplexity, they're generating their own what they're doing. And older physicians, I'll put myself in that bucket. We grew up doing things a different way, and we trained in medicine to develop different styles. So, for example, you could summarize all the records for me using AI, and I think that's actually a fantastic AI use case. But I'm so used to reading things myself and taking notes and abstracting information that way. Or we could use one of these AI scribe solutions to write my notes. But to me, the note writing process is how I think, right? It's part of the clinical care I deliver. It forces me to synthesize information. It forces me to summarize my thoughts. It's part of my clinical reasoning process. Or you can give me a, handy co-pilot that I can ask, hey, handy co-pilot, what's the treatment for condition X? And often it'll be good enough, but there's kind of some context we lose where I'm just so used to searching for information on Google Scholar or Up to Date or somewhere else and clicking the link myself and seeing where the information's coming from. I'm not saying that I wouldn't use any of these tools or I won't use any of these tools, but I'm trained in this different way of experiencing the world, this different way of practicing medicine, that it's going to be harder for me to change my patterns than perhaps someone who's just graduating medical school today, or certainly someone who's going to graduate medical school 10 years from now. That's kind of what I meant by that, needing a new generation. I think currently practicing clinicians will certainly embrace many of these tools if there's enough value, going back to your earlier point. But we're not necessarily natives. And unless there's enough value or incentive to activate us to change, we may resist to certain degrees that newer generations of clinicians who grow up with these tools and train with these tools from the start will just become more natural for them to use them.
Thank you for that amazingly valuable context. This conversation is really, let's position it as a bit of like a seminar where we have 500 people working in tech listening, trying to understand what they can learn from healthcare. And been some really interesting things that you've brought up. Number one to me is that people love their nurses. So why are we trying to intermediate them? Another one is that a lot of the mistakes in healthcare are really impactful. They're worth a lot if you make a mistake.
Yeah.
Also, we've overstated the value of technology. What I'm trying to understand here are what are some lessons or models, mindsets, or frameworks that someone building a tech product today can implement? And I'm trying to frame it around this idea that a lot of the context that matters in decisions isn't in the problem. When we think about healthcare, the issue isn't always necessarily the quality of the interaction. It's how can we get them to listen to their own symptoms and go to the doctor? How can we make sure that they're regularly checking themselves? How can we make sure that they have confidence in the system? These are all things that are outside of the product, but are part of the system as a whole. Is there anything that you would like to share with people to help them understand that the problem sometimes is a lot bigger and broader than they might interpret it to be?
As I mentioned earlier, I would suggest getting close to the people who are experiencing healthcare from all sides so that you can understand what are the real problems and how do people experience these problems. And then I think it's a matter of designing solutions that are not just purely technology, right? You can't just deploy software. It's about redesigning work and redesigning how we do things and challenging assumptions that we've made for a long time. So I guess that would be my advice for people approaching the space would be kind of that beginner's mind of why are we doing things this way? What is the problem? What potentially could work? How do we develop better solutions? And then the solution, of course, cannot just be technology, right? It has to be workflow and team composition. And it's really a larger redesign process that is, the technology in many cases enables, but it's not, right? Healthcare is about people, it's not about technology. So the technology is a facilitating factor, but it's not the center of it all.
You brought up the scribe technology that ambiently listens and contextualizes what's happening and puts in a workflow. I actually did testing for a major tech company on something similar. And without that specialty workflow, it comes across as creepy and intrusive. And I think this is one of the challenges of this era is we're taking technologies and forcing places it should fit, where
Yeah.
you're definitely looking at it from the other side is this is what a human goes through. These are the people that are trying to help them. How can we not disintermediate them? How can we bring them closer where perhaps the interaction is more efficient? Have you seen any examples of solutions or workflows or services that have helped bring people closer together rather than apart?
So just to stick with your ambient scribe, there are ambient scribes that are customized for different practice environments. So if you just take a generic transcription tool that we can use on a Zoom call or on any meeting, when you throw it into healthcare, like, right, what's different? Let's just use this. Well, for one, there's different terminology, there's a different lexicon that the models need to understand. But beyond that, notes are not just a long transcript, they're not like meeting. Their notes are quite different. And then the way that a primary care doctor writes their notes may be quite different than the way a psychiatrist may write their notes or a physical therapist. So I think it's possible to start with the more generic foundational technology, but then working to adapt it to be purposely fit to certain situations, certain types of care models. So yeah, that would be an example that comes to mind of it's not just taking generic technology and trying to throw it into a system lazily. It's about how do we take this and sculpt it in a way that makes sense for the people who are using it.
It sounds like you're advocating for augmentative capabilities where we augment things that are happening rather than automation. Is that one of your
Yeah, well,
core
no, I mean,
philosophies?
I think so. Well, I think automation's important. I think automation is a great opportunity to do better. But we have to automate the right things, right? We have to automate work that humans do not need to be involved in doing. And the main risk, the main concern is we cannot automate relationships and we cannot automate critical thinking. Those are two areas of clinical practice that must be safeguarded at all costs. We can certainly automate a lot of the noise and a lot of the low level tasks that really aren't that important for a clinician or any human healthcare worker to do. But we really must safeguard some of the tasks that are most important. And many tasks from the outside, many tasks that seem kind of low value, wasteful, kind of like who would want to do that, are actually really important for relationships and critical thinking. You could send me a message if you're my patient and say, "Hey, you said I should take this acid blocking medication last week. I've been doing it for a week now. I'm not feeling any better." I could have a bot write back to you and say, "Oh, well, you know, take it twice a day instead, or I'll switch to this." You don't want that. That's not what you want as a person. You want to hear from me, right? So that would be one example of the risk of automating something that theoretically should be fine, but in reality, we would lose a lot. Or going back to the note writing kind of theme we're circling, we could automate our notes, right? You can argue, who cares if a doctor sits and types their notes? It's a big headache for them. They could see more patients if they didn't do that, or they can get home for dinner on time. But what about the critical thinking that's involved in note writing? So I'm all for automation of the right tasks. I think a challenge is that many tasks that seem like they'd be perfect to automate are not necessarily ideal for automating, or at least not ideal all of the time, right? Some of the times it may make sense to automate a certain task, but other times it won't. And we lose all that nuance because we're so accustomed to this binary thinking of either it's going to be technology or it's going to be a human. And really, it should be a blend of the two with different amounts of one or the other, depending on the circumstance at hand.
So something we like to speculate on here is how the technology is going to change organizational design. And when I hear you talk, we're Canadian, both of us, and what's happened here in terms of the model to meet the demand is it went for a fragmented model where you don't have a family doctor instead you have walking clinics. Now, this technology has the ability to continue that fragmented model where you can have disintermediated care through some nearly anonymous person or entity, or the technology can support organizational design that augments the capability of your primary care physician and enhance the reach they have and make them feel more intimate and close. Would you go back and support one of these organizational designs based on what you've seen work or not work?
Yeah, I think we clearly must redesign how we deliver care. So redesign different care models. And then part of that process is reorganizing who is delivering care, how are they delivering it, who are they interfacing with, who's on their team. One of the challenges we've seen with electronic health records is we kind of put these down in the center of doctors' offices, but we didn't quickly enough or sometimes ever reorganize who was a part of the team. And as a result of that, a lot of this kind of digital exhaust, all the, extra notifications and orders and all that just went straight to the physician because they weren't partnered with other people who would be kind of better equipped to handle that extra work. So I can't answer RP in terms of like what's the ideal design other than we clearly must redesign if we're now bringing technology into as an extra teammate per se. And a lot of that will require not just redesigning our workflows, but also reconfiguring our teams and considering what are the different roles people need to play. And do we have enough of those people? Do we need to recruit more? Do we need some people to change what they're doing, et cetera?
So you mentioned before about how there is a lack of access to healthcare for too many people. And kind of circling back to the first organizational design that RP had mentioned about this idea of using technology to get people into healthcare sooner or with less of a barrier to entry. And there have been studies and just also conversation and press around this idea of AI being able to outperform or at the very least similarly perform with surgeons and practitioners when it comes to diagnosing diseases, and with a big caveat of unbiased AI systems. What do you see as some of the positive and negative consequences of people potentially handing more of those healthcare queries and trust in their healthcare needs to AI systems as like a first line of entry before going to a practitioner?
Yeah, well, I think that, of course, there are privacy and data security concerns, but presumably we can assume that these are safe, secure systems that maintain privacy. AI systems are, right, they're imperfect, just like human physicians are. As everyone knows, language models tend to make things up. They're not always grounded in reality. And as I mentioned earlier, there's not always a right answer. Often there is no single right answer. So I think those are the risks, but I think there's also opportunity, right? There's opportunity because people want faster responses, quicker input to their needs. So I won't say that these are bad. I think there's just a risk of misinformation. You could argue that physicians give misinformation too. So that would be one thing. Another would be context. So there's a risk that you're getting information out of context. So if you get information from a chatbot that says, "Oh, there's a high likelihood that you're suffering from this," what do you do then, right? You start reading about how terrible this thing could be in a small perspective. If your family physician saw you and said, "This is what it likely is," I've seen many people with this condition over my 25 years in medicine. And actually, it sounds kind of frightening, but almost everyone does quite well and lives a thriving life. So there's a risk of losing context. There's a risk of losing human connection and empathy, right? You're kind of getting something from a machine that, right, kind of impersonal, or people will bring up that ChatGPT sounds more personal and empathetic than a physician does when writing messages. Okay. But I still think there's a value to seeing another human who understands what it's like to be an alive human. So I think there are some risks. There are also risks of, well, what happens next? Often diagnosis or giving a possibility of what could be going on. That's not always the rate limiting step. It's like what comes after that. So the suggestion is that you're experiencing X, Y, or Z. Well, usually that requires some follow on testing or evaluation. You're speaking to a machine. That machine can't do it for you. You somehow have to get plugged in. I think there's opportunity. I think there's potential benefit, but I do think there's a risk of misinformation, information out of context, information lacking empathy and human compassion, information that presents and you can't do anything about it because then you're stuck waiting for the next step, which you need to interface with the regular system. So, like most things, sometimes it'll be beneficial, sometimes it won't.
Our guests have typically speculated that we are still in an era of AI augmented products, so not really in an AI native product era yet. If our goal was to truly improve healthcare outcomes and efficiency, what types of futuristic AI native capabilities do you believe are needed?
Oh, that's hard. I won't pretend I have the answers. I will say that we need tools that are solving real problems. The focus has largely been on removing kind of administrative drudgery, so offloading some of the work that no one wants to do and maybe humans don't need to do, which is great. But I think really to move the needle, we need to make better decisions. And I don't think today's AI is necessarily ready to move into clinical decision making with enough reliability that we can be confident that we can trust it.
One of the obvious streams where threads with that is whether or not an Apple or an Amazon plays a bigger role in healthcare and getting you to a physician. Do you see that becoming the case?
Yeah, so well, Amazon does have a large medical practice, right? They bought One Medical and they have a big pharmacy program. Apple has kind of not gotten directly into healthcare services, but they have clearly health related products. To know, I think the reason you're probably interested in your audience may be interested in healthcare, and certainly all the big tech companies are interested in healthcare, is because it's almost a fifth of the US economy. So it's hard to ignore. And I think also it's so fundamental, right? What problems would you rather work on than helping people live happier, healthier lives? So I think from both a pragmatic market possibility, but also from the I want to feel good about myself when I go to sleep each night for working on really important problems. I think it's hard to ignore healthcare. And I think it's great that so many technology companies and tech forward people and designers and technologists are moving towards healthcare. We need all the help we can get. At the same time, I think we need to ensure that we're grounding ourselves in the real world, that we're partnering, that we're not ignoring the current stakeholders, the people doing the work, the people receiving the care. So, yeah, it's an exciting time.
I think it's also fascinating because we finally have access to a ton of biometric data. And we're at the point now where we actually can see how we're trending. And there's obviously this whole movement of biohacking and such. And we have all these wearables that all have all this power now. So, from an outsider perspective, it seems like we're entering this entire new era of healthcare. Is that what the insiders believe or not?
I think we are just not as quickly as people imagine. And I always return to this quote that you've probably heard, or many of your listeners have heard from Roy Amara, right? Amara's Law. It's along the lines of the world doesn't change that quickly in a short period of time, but in a long period of time, it does. So I think the quote is something along the lines of we overestimate the impact of technology in the short term and we underestimate its impact in the long term, right? We can't imagine what things will be like in 50 years. Who knows, right? Who knows where we'll be? I can say with a high degree of confidence that a year from now, healthcare will not look that different than it does today.
Thank you so much for joining us. Where's the best place for people to follow along with your writings and your analysis? I see you're writing in all kinds of places. Where's the best place for them to keep track of you?
Yeah, you can follow me on LinkedIn. I write there somewhat regularly, and now I'm writing regularly on Forbes as well. So those would be two places. You can check out the work we're doing at my organization, University of North Carolina. We're very proud of the work we're doing. So you could visit UNC Health, or you can visit the UNC Department of Medicine to read about some of our work here.
Amazing. Thank you so much, Spencer. It's wonderful to dive into this. It's the ultimate case study for, I think, everyone listening here.
Thanks so much, guys. I appreciate it.
Thank you for listening to the Design of AI podcast. We interview leaders at the forefront of AI to unpack strategies and lessons for designers and product teams. Make sure to follow us on your favorite podcasting app. It really helps us if you leave reviews. To get more resources, subscribe on Substack at designofai.substack.com. This episode was hosted by Arpi Dragfi-Guerrero, the founder and head of product strategy for PhD Research, and Brittany Hobbs, VP Insights at Hughes.